Humber Coast and Vale Cancer Alliance brings together all of the organisations that commission and provide cancer services locally. We do a lot of work with voluntary organisations such as Macmillan and Cancer Research UK. We work very closely with local GPs and with our hospitals and with our clinical commissioning group partners and Public Health England. Together we are working to improve cancer outcomes for our local population, and that's from the early detection of cancer services right through to people living longer and having better health outcomes. So each week 168 people in Humber Coast and Vale are diagnosed with cancer, and the Alliance seeks to improve the survival rates of those people by ensuring that we can detect that cancer at the earliest opportunity. So what's key to that is actually about increasing cancer awareness and uptake of screening. One of the ways in which we do this is through our Cancer Champion training programme. It's about real people raising awareness about cancer in their local communities. The training sessions cover the key facts, statistics and symptoms, and the screening that's linked to several cancers. Early detection really does save lives, and Cancer Champions encourage their friends and family and their colleagues to be aware of what the signs and the symptoms are. Identifying cancers at an early stage means more people require diagnostic services such as CT scans, MRI scans and biopsy. Working together, we're developing a clear vision for future services that actually make the best use of our resource and ultimately then result in an improved patient experience. Timely access to treatment is also important with regards to cancer survival, as well as post-treatment quality of life. As an alliance, we are working with our primary and secondary care colleagues, bringing clinicians together to develop rapid diagnostic and assessment pathways for lung, prostate and colorectal cancers. The importance of doing this is to rule out cancer as soon as possible and put patients' minds at rest where cancer is not diagnosed, providing the right treatment where appropriate. Receiving a diagnosis of cancer can be a very frightening experience for patients and for their families. And in some cases, people have to travel a long way from their local area to receive their treatment. That's why the Alliance has provided funding to support transfer coordinators in our local hospitals, which helps to ensure patients move through their pathway and navigate what can be a really complex system in a much simpler way. Another aspect of work that the Alliance does is to take feedback from our patients. We've established a community network which supports those affected by cancer to have the opportunity to share their experience and be involved in how they influence and shape the work of the Alliance. Over 53,000 people in Humber Coast and Vale are living with and beyond cancer. And we must work together to improve the care and support these people receive to enable them to be more in control and be better equipped to cope with their treatment and their recovery. We understand it's not just the physical impact of having cancer which is important to patients, but also how it may affect someone mentally, financially, emotionally and spiritually. The Living With and Beyond Cancer programme is an important element of the work of the Cancer Alliance and aims to ensure that patients are supported and enabled to live as well as possible following their cancer treatment, and that any follow-up care is appropriate to them and meets their specific needs. As an alliance, there are 4 core elements to what we're trying to achieve. The first being early diagnosis of cancer in our community. The second is about ensuring we've got enough capacity in terms of rapid access to diagnostics. The third being to transform our treatment and pathways, which ultimately then leads to living with and beyond and a better quality of life for all of the patients. And together, that ensures that we're working towards achieving world-class outcomes for cancer services in our local communities.